Chapter 1, Introduction to Life After Stroke. Congratulations on investing in your health, recovery, and ability to find hope in a tunnel of darkness. A stroke is a debilitating condition affecting millions of people every year. A type of cardiovascular illness, a stroke can affect the arteries and brain. There are many different types of stroke, but most result from a clot that interferes with the passage of blood to the brain, or from a ruptured blood vessel, causing the same effect. According to the National Stroke Association, in conjunction with the American Heart Association, stroke is the number 3 cause of death in the United States alone, preceded only by heart disease and cancer. Stroke is unique in the way it affects the quality of life of survivors. While it is a leading cause of death, there are millions of people that have a stroke and do survive. If reading this guide, you may be a survivor or friend, family member, or caregiver of a survivor. Your goal in reading this guide is likely to find ways to improve your quality of life. When it comes to quality of life, physicians and doctors have worked for some time to contribute to improved living for survivors of stroke. There are many quality of life studies formally focusing on patient survivors of stroke. Most of these studies focus on assessing and trying to assess ways to improve the quality of life patients experience following a stroke. Why do we repeat this point in this paragraph? The key to hope, the key to survival, is the ability of a survivor to maintain an adequate and enjoyable quality of life. Caregivers and family members of stroke survivors must also learn to accept a new life, but one that is worth living. This book will help guide you in that journey. Many of the studies we talk about suggest that survivors of stroke experience declines in their perceived quality of life resulting from multiple factors, including impaired functional ability, psychological factors, and ability to communicate or lack of ability to communicate with others. One can easily understand this given the detrimental effects a stroke may have on a person's ability to communicate and function. The quality of life following a stroke is so important to stroke survivors' recovery, it is the leading topic and concern of most primary and secondary caregivers. Due to the nature and side effects of strokes, however, many caregivers and doctors find it difficult to assess the impact stroke has on quality of life because of physical and functional impairment following stroke, including one's inability to speak or sometimes understand what others are trying to relay to them. For this reason, one of the first focuses of rehabilitation for many survivors is speech and language rehabilitation. Many doctors will initially rely on reports given by caregivers or family members in the early weeks following a stroke to assess a survivor's recovery. These reports can have a dramatic impact on one's recovery in the short and the long term. Why is this important? A stroke can be one of the most debilitating events that occurs in one's life. For that reason, it is important doctors and rehabilitation experts work to improve the perceived quality of life for survivors and their caregivers. Many survivors may find their exclusion in decisions regarding their health frustrating and intolerable. Because stroke often affects one's ability to communicate effectively, however, this can be a trying circumstance to overcome. Without hope, many survivors may face rapid decline, little progress, and even suffer from a second stroke, one that may prove fatal. Thanks to so much effort and advances in modern technology, as well as treatment protocols and approaches to stroke recovery, survivors are finding they have more and more say in their journey toward recovery. There are more opportunities survivors can look forward to, and more choices healthcare professionals can offer patients looking for hope in light of their disease. Caregivers are also finding new hope and support avenues, and education about caregiving and addressing the needs of stroke survivors. Who this guide is for. This guide is a practical approach to understanding strokes, its effects on the body, and effects on survivors and caregivers. The intent of this book is to help survivors and their family members learn what life may be like following a stroke, and learn what action steps they can take to improve a stroke survivor's quality of life following a stroke. This guide is purposefully designed in a simple-to-follow manner, so survivors and caregivers can quickly and easily find answers to pressing questions or concerns they have about the effects of stroke and its impact on one's quality of life. This book utilizes as little medical slang as possible, making it easy for anyone to understand and adopt the concepts and tools applied in this book. Written with the intent to help survivors and their families maximize their potential for experiencing a full life, Life After a Stroke really is in many respects a healing tool for patients and family members. This book does not go into all of the biological factors leading up to and occurring immediately following a stroke. It does, however, include a brief overview of the immediate effects a stroke has on a survivor, and steps survivors and caregivers can take to improve the quality of their lives following a stroke. Not everyone who experiences a stroke will survive. Those that do suffer a stroke, however, often have a good chance to regain much of their ability to communicate, function, and improve their quality of life. The mission of this book is to provide survivors and family members with hope, encouragement, and information. Information and education are, after all, two of the best tools anyone can use to overcome any life challenge. The authors of this book and publisher are not doctors. The information provided in this guide is meant for informational purposes only. You should always rely on the expertise and guidance of trained and qualified professionals when assessing the best course of rehabilitation and treatment for a stroke survivor. If you are looking for positive encouragement and hope, however, as well as valuable resources in your journey toward recovery, you've landed in the right place. Remember that doctors and rehabilitation experts become a crucial part of your healthcare and wellness team. What stroke survivors need more importantly than anything is a group of caring, supporting, and educated people to support them during the challenging road to recovery. Much of the information gathered for this manual includes insights provided from the American Heart Association and American Stroke Association. Such organizations are committed to improving the quality of life of patients overcoming stroke and many related disorders. How to use this guide. Whether a survivor or caregiver, this guide will provide you with hope in your journey toward healing and recovering. This guide will provide you with valuable information about the general effects and long-term effects a stroke has on patients and their families. You will also learn of new treatments on the horizon that may dramatically improve the lives of patients suffering from the side effects of a stroke. Included in this guide are links to support groups and knowledgeable sources where survivors and caregivers can find even more information about life after a stroke, and links where they can talk with other survivors and family members or caregivers of patients recovering from stroke. The more you learn about any health condition, the better equipped you become to face the challenges that lie ahead. Centuries have proven that the mind has incredible powers to heal. This book will help you discover how powerful the will to survive and thrive can be in your journey toward healing. Use this guidebook as your armor when fighting back against the ill effects of a stroke, so you and/or your loved one can go on to lead the quality of life you deserve following any debilitating illness. Many doctors and patients alike agree that not knowing is one of the biggest impedances toward greater health. You will avoid this problem, however, by reviewing the information in this guide and learning as much as you can about recovering from stroke and improving the quality of your life. Use this guide to learn as much as you can about stroke and the effects stroke has on a survivor's body during the recovery process. Knowledge will make you feel stronger and more powerful, providing you the impetus you need to conquer your fears and overcome anything. Believe, and you will receive the inspiration you need to show courage in the face of hardship and inspire others to do the same. This book will encourage stroke survivors to think of their lives in terms of practical abilities rather than disabilities. Everyone has the power and ability in us to regain a positive outlook on life, from which we may draw strength in the face of adversity. Keep saying, "Yes, I can," and eventually you will create a positive outlook on your life and hasten your recovery. Everyone at some point in their life will face some disability or inability to accomplish or do things in a way they perceive as normal or ideal. This book will encourage you to view life practically, but also to look past any physical or emotional limitations you may have, so you can live life to the fullest and truly learn to enjoy your quality of life, whether a survivor of a stroke, caregiver, or other loved one. So, let us now begin our journey by first reviewing some of the more common effects survivors experience following a stroke. Please keep in mind that many patients will experience more dramatic recovery and results depending on the severity of their stroke and the parts of the brain and body affected by the stroke. Once a patient captures or maintains the ability to communicate and understand effectively, however, their potential for success is limitless. Remember this as you begin your journey toward better understanding life after stroke. Apply the principles in this guide to everyday life and find out how, even in the face of adversity, life can become a truly intriguing place to live, filled with potential and the ability to recover from almost anything, if that is, you are willing to put your faith in your recovery and your ability to help yourself and others during the recovery process. Success may not happen overnight, but it will happen if you commit to your life, your quality of life, and your right to enjoy life to the fullest extent possible. Let's begin by gaining a comprehensive understanding of the immediate effect stroke has on one's life.